Good morning. Today's topic is salvage of Medicare. It's a controversial issue. As you know, our costs for Medicare have been rising and our coverage is getting less and less, choice is getting less and less, because the reason being there's certain percentage of the Medicare recipients can't afford supplemental coverage, can't afford any other policy other than joining the health maintenance organizations or PPOs. They can't afford the supplemental coverage, having to pay additional for the supplemental coverage. So this is Dr. Bengala. This is Consumers Doctor, Dr. Bengala. Thank you for joining CCN Networks. How do you salvage Medicare? A lot of people, Paul Ryan has done a lot of work on how to salvage Medicare. But he has had a chance to make some changes when he had the Congress and the Senate and the presidency. He didn't do it. Now, everybody knows that Medicare is going to be insolvent down the line, maybe 10 years, 15 years. Nobody knows. How do you make Medicare solvent? I'll tell you how. It's a simple solution, folks. I don't know why people can't figure it out. Anytime government handles Medicare and give it away to conflicting parties, like they're subcontracting so-called managed service organizations, so-called full risk contracts. They're giving away the contracts to organizations where they have a conflicting interest. They're not interested in you and me or common folks. They're interested in making money, taking the money from Medicare and raising their stock prices by restricting the coverages. As simple as that. How much does it take to be a genius to look in that, where government is investing in mid-level agency, which is not right? You know, they have spent, I'm sure it's a Medicare probably must have, if $2.88 trillion is by the employer subsidized expenses, it is close to $1 trillion, folks. It's close to $1 trillion. I'm not sure how much Medicare is paying these so-called providers, insurance companies and providers. They have conflicting interests. They don't have the interest of the common folks, like people who are in the low-income bracket. They're not interested in lower income bracket or uninsurable group. They're not interested in that. Come on. Let's give a serious thought to it. Okay, I am a senior. I am an AARP member. Fortunately, I've had health savings accounts, which I set it up about 20 years ago. I probably have about 100,000. It's not much, about 100,000. But I can afford health supplemental coverage. But I'm talking about majority of the folks, they don't have that cushion. I'm addressing regarding the common folks in the lower income and disabled, people who are unemployed, Medicaid, and people in their seniors above 65. They're not even getting enough Social Security to take care of themselves. I would like to see government invested in Americans, especially in seniors. They invest in seniors, folks. You know, they give a Social Security, I understand all that. People, even the social security is not enough for average folks. Then I seriously think I came across most of these people are on the so-called managed care plans. What the government is doing is they're shifting the burden on the managed care organizations. What they do, they have a co-pay, they have less coverage, they have no choice, they have to go to certain groups, they have to buy certain drugs, they can't pay for the drugs, Part D coverage. There are more things, and it's so complicated. This Medicare makes it so complicated to get health care. Medicare Advantage. I don't know what Medicare Advantage. I still trying to figure. Medicare Advantage is nothing but another health maintenance organization. They get the money from the Medicare, and I've seen some of the providers getting full risk contracts, folks. Your money is Medicare is giving to full risk providers like doctors, healthcare professionals, foundations. They're taking, a lot of nonprofit organizations are getting your money, yours, mine, everybody's money, and they're supposed to provide you the care. Come on. You know, it's a common sense. Are they interested in the common folks for the coverage? If they're giving, I don't know, God only knows, about $1,200, $1,000 to every full risk contract holder, it doesn't have to be an insurance, it could be anybody, any provider. These medical groups are taking full risk. They're taking the risk. They may be taking the risk, but can you imagine Medicare is giving your money to these providers, and you're at the mercy of these providers, and they restrict your coverage? How can Americans go with that? I just don't agree. The philosophy of giving Medicare and shifting the burden onto the managed care organizations, come on, it is just not right. Give your money, your hard-earned money, to these full risk contract holders. They're accountable to only Medicare. What I'm saying is, give that money to the average. Invest in American. Give those funds. If the $1,000 and $1,200 mandate all the seniors, they should have insurance coverage. I understand that, like what Obamacare mandated. But you and average Americans, they know how to get an insurance coverage, like an auto insurance. Come on, everybody, all the seniors get an auto coverage, auto insurance. Why can't we get a health coverage, like an auto insurance? You give that money to us, and I know how to take care of my health. I don't need the government to tell me where to go, which plan to join, which doctor to see. I don't want any one of that. I want the Medicare to give that $1,000, $1,200, giving it to the full risk providers. Give that funds to the individual American folks. We need that, and we can get whatever affordability is, we can get a deductible policy. If I can afford $1,000 deductible, my premiums will be a lot lower. Believe me, it doesn't cost you $1,200 to get insurance, or $1,000. I will take that $1,000 and get my own coverage, lower my premium basing on my economic status. So if I can take $5,000 deductible, let it be. My premiums will be lower. Then what this Medicare is doing is giving the responsibility to giving that money to the providers and managed care organizations. That is an old concept. That's why the cost of the premiums are going up. Cost of the premiums are going up. And look at it. I stayed in the hospital for 23 hours. I had an angioplasty, coronary angioplasty. 10 days later, I received a bill. 10 days, I received a bill for $227,000. You know why this happens? Because Medicare is putting the money into these managed care organizations, into these so-called, they restrict you. You can see only certain doctor. You can see only certain. You can go to only certain. If I get that money, I will get an insurance myself. I can get a deductible premium for much lower, 3, 4, 5, 600, depending on my age, and I can put that 5, 6, 700 into my health, personal care accounts or health savings accounts. If the Medicare needs to be solvent, folks, this is the way to go. Give the responsibility to individual Americans, and Americans know how to take care of their own health. These people keep talking about, these representatives keep talking about Affordable Care Act. This is nothing to do with affordability for the common, lower income folks. This is about the control. Control. As Abe Lincoln said, this free enterprise America can never be invaded from an outside entity, but it will be. If we falter on freedom, it will be, because we lost the freedom. This is where America shines, folks. Let America shine through a private enterprise. Give that control to the consumers, all the AARP members, seniors, everybody. Give that $1,000, $1,200, whatever the Medicare pays to the supplemental, whatever the HMO, health maintenance organization, or high-risk contractors. Give that money to us. I will get my coverage. I don't need, Uncle Sam to tell me where I can get the coverage. But mandate it. Make sure people have the coverage. I understand, that's where the government has to get involved. Make sure everybody is covered. So the hospital, healthcare facilities are viable. So they need to get. But by having the consumers in the driver's seat, if I have the money, you think I will go and spend $227,000? And Medicare paid $35,000. Medicare, this is not even a managed care organization. Even managed care organizations, Medicare paid $35,000. And supplemental paid another $30,000. So they made $60,000. This procedure could have been done under $5,000. This is why the premiums are rising. This is why Medicare is insolvent, folks. These billing agencies, Surprise Medical, they need to go. 9,000 billing companies billing these healthcare professionals all over the country. They're billing from across the world, across the continent, billing this Medicare, insurance companies. How does that work? It doesn't make sense. Why don't you let Americans take control and let Americans be in the driver's seat? Let them pay as long as they have the mandated coverage. People are in the uninsurable group or lower income group. Health Review Authority, which is a public-private partnership, they will classify people who can't afford. They can get certificate of guaranteed coverage. Once they issue the certificate of guaranteed coverage, government is responsible, and insurance companies will love to take care of them. Instead of Affordable Care Act, it's politics. Just get the certificate of guaranteed coverage through a public-private partnership. This is where America shines. As Ronald Reagan said, America will be a shining city. I can guarantee you that. America will be a number one healthcare back again. Right now, America is spending $3.7 trillion, folks, which is not acceptable. And we rank 37th. Can you imagine that? It is mediocrity. So-called. It is unacceptable. If you give the same money to these, invest in Americans, $10,000 per person, Americans do a better job at lowering. Look at the auto insurance. Look at the food industry. There's competition, not consolidation. There is free enterprise. This is where America shines. I would like to see the attitude change. Let's have a public-private partnership in healthcare. We can solve anything, and let the consumers, this is very important, this is a freedom, this is what freedom we are talking about. Let the consumers decide where to go. Let them choose their doctor, let them choose their health. If America doesn't provide the care what we need, there is a doctor right across in Cayman Island. He will do open heart surgery for $800, folks. $800. American healthcare industry has to wake up. You have to wake up. You cannot charge a graft for the like a valve replacement to a transfemoral. It's $50,000. How can you afford that? But if you have an open heart surgery, the same graft is $5,000. These companies have realized how to rip the insurance companies, folks. We need to stop ripping these insurance companies, ripping this Medicare. We need to stop it. Give that authority, give that power back to the people. I beg you, give it back to Americans. Let Americans take care of their own health. If you like this channel, join me in CCN, Connect Care Network. I'll keep talking about till we achieve individual American are empowered on the healthcare. It is a right, as everybody says, it is a right. Healthcare is a right, but government has to facilitate, not mandate, facilitate and give them the assurance that everybody is covered. That's the government's role. If you like this, subscribe and hit the notification button. Please make some comments, and I'll be back in the next episode. Thank you.